Okay. I've been using Botox since, I would say, around about 1997. So I've had quite a deal of experience. So I've been fortunate enough to be asked onto the advisory board for Allergan that has Botox, and I see quite a number of patients every day that require it. There are some, of course, basic techniques and advanced techniques for injecting the Botox. And I'm going to go through some of the more advanced techniques today. Essentially, the basic techniques are when we're injecting above the level of the eyes, really, from the eyes and above. In those areas, there's really not much that you can get into trouble with. The beauty about Botox is that you inject it, it works, and it disappears. The bad thing about Botox is you inject it, it works, and it disappears, so the patient has to come back. So that's good and bad for you. And I think when there's a chap called Martin Braun who is from the or from Canada. Oh, that one's not working now. So just, oh, there we go. A chap, Martin Braun, who is from Canada, and he is the largest injector of Botox in the North Americas. And he's quite right that when he says that the most important aspect of using Botox is not so much to get rid of the wrinkles, but the patients, especially your female patients, come back on a regular basis to say, you know what, I don't care about the wrinkles, but my brow has elevated. I've got a higher brow, my eyes are more open, I look more refreshed. I think that's one of the things that we see and need to appreciate. Wherever you're injecting the Botox, whether it's in the beginner or advanced courses, it very much depends on patient to patient and variable injecting points. And also, when you actually get the patient back for a second time, you look at your chart and say, okay, well, this is how I've injected the patient last time, but it may be different where you need to inject the patient on the second occasion. And especially if the patient is not, if they come back at 3 months, for example, and some of the Botox is still working, then you have to adapt your injections to those muscles that are actually functioning. Now, the brow lift and the brow shaping, this is really more for the younger patient. One of the things about advanced techniques in Botox is that more often than not, your patients are not walking in the door and saying, I want to get rid of my lines, I want to get rid of my crow's feet. These patients are almost the type of things that you have to suggest to the patient, because you can look at your patient, do a full facial assessment and say, you know what, you'd be a little bit better off with the brow slightly elevated. Maybe we can fix up that gummy smile. Maybe we can fix up your neck and do a little lift to help your jawline. The patients don't come in asking for this. They will come in and say, I want to get rid of my frown, I want to get rid of my crow's feet, I want to get rid of my forehead lines. But these advanced techniques, they don't actually come in and ask for. So as a result of that, you have to be reasonably conservative, because some of these advanced techniques, if you put the Botox in the incorrect position, you may actually get some adverse effects that the patient is not liking. So if that occurs, it's something that you've sort of brought on to the patient. So it really is somewhere between rejuvenation and pure enhancement. And this is for all parts of the face, not only the brow. Now, what do you think? Has Kylie had Botox? Yes. I reckon she must have, yeah. I'm not sure who. I think there was a famous surgeon down in Double Bay who has treated her. Now, I think whenever you're looking at the anatomy, and this is always an important thing, could we maybe just dim the lights just a little bit at the back there? Thank you very much. When you look at the anatomy of the forehead, really there is only one elevator of the brow, and that's the frontalis muscle. All the other muscles, the corrugators, the procerus, the orbicularis muscles, these are all depressors. So if we want to get elevation of the brow, and especially specific elevation of some areas, we have to target muscles also specifically. Now we can see here this is a very significant corrugator and glabellar lines forming. And in the traditional patient, you would inject the procerus muscle and along the corrugator muscle here. Now, in doing so, by relaxing these muscles, sometimes you will get already elevation of the lateral part of the brow with the frontalis muscle. Essentially, it's a bit like the yin and the yang. There's, for every elevator of an area, there's a depressor as well in terms of muscles. And you can inject Botox in a young girl who's got a reasonable breast and not too ptotic. You can inject Botox in the lower part of the pectoralis muscle. The upper part will contract even more, and as a result of that, they can get a breast lift. That's certainly an advanced technique. You need lots of Botox to do that, but it is something that you can do. And that's because you're looking at relaxing some of the depressors and making the elevators work even harder. So when we're looking at brow lifting, it's the type of thing, some of the younger patients will come in for brow lifting and ask for specific brows, the arched brow, the flared brow, the horizontal brow. It's usually not something that men ask for, and it's usually not something that the older patient will come in and ask for, but it's something that the younger patient that just wants a little bit of manipulation. Most of the younger patients who come in asking specifically for changing of the brow have seen it on the internet or have had it done before or know someone who's had it done. So you have to ask the patients to close their eyes and relax their forehead, then look straight ahead. You have to relax all the muscles, and you must get the patient to move. I often will get the patient to frown and raise their eyebrows and close their eyes and do things just so I know exactly intimately what the muscles are doing. Quite often it's difficult to get a frown, and so you have to give the patient a mirror as well to make sure that they know what they're doing. I think it's important to look for pre-existing lid-ptosis, and taking photographs is also important. Every time you do a Botox injection, take a photograph first of all. It's a digital photograph you can store away, because quite often the patient will come back and say, look at what you've done to my brow, look at what you've done to my eyelid, it's dropped. And you look at the pre-op photograph and it's there. And so it's very important, because you know that the Botox is going to go away, but you don't want the patient to be unhappy and accuse you for something that you actually haven't done. So to try and get the arched brow, if you think that the elevators of the brow, the frontalis muscle, the depressors are the orbicularis muscle around here, and we've got the corrugators here. So to try and get an arched brow, what we're trying to do is relax the orbicularis muscle here and just get elevation of the frontalis muscle just in this central portion. So sometimes all you need to do is put a little bit of Botox just right under the central part of the brow. The flared brow. Now, there's going to be a certain element of flaring that you can achieve, but when you look at a brow like this, this brow is really quite arched. And to get a flared brow, to get it right back up, right back up like that, flared brow like that, it's impossible. You cannot lift that brow, to be a flare like that. So sometimes you have to go through this with the patient and say, the impossible is not achievable, and sometimes it's a matter of changing the brow with plucking and painting, etc. But if you want to get some flaring of the brow and lifting this lateral part of the brow to take the heaviness away from the lateral eyelid, then it's injecting small amounts just below the eyebrow here. And then I always will inject the crow's feet as well. Whether you inject the whole lateral part of the crow's feet or just this more superior part, relaxing the orbicularis muscle laterally here. The horizontal brow, what we want is to get some elevation of the medial part of the brow and then a little bit more elevation of this part here. The horizontal brow, most people don't come in and ask for a horizontal brow. Most want the arched brow because you're trying to get the heaviness away from this lateral part.